Hi everybody, this is Dr. Garner here, and I am with a patient, so we're masking. We're gonna go through some medical therapeutic yoga based work for after you've had a hip scope. You can certainly do this before the repair, but sometimes you need that repair in order to move forward and fully recover. So after that, oftentimes, once you finish the protocol, you still feel like, I can't get fully back into it. I can't get back into the activities I once did, even though the surgery was a success and you finished your typical 4 months of PT. So here's one of the things you can do to test it out. You want to have really nice fluid movement. So instead of this being a wide angle forward seated bend, like you might see yoga focusing on flexibility, which I rarely use yoga to focus on flexibility. It's all about stability and safe joint mobility, or what I call controlled flexibility. We're going to bend the knees and make sure that you're comfortable. No hip impingement. If you have hip impingement, go see your local friendly pelvic ortho PT who can help do joint mobilizations for that. Once you're here, make sure you feel stable. We're working on fluid movement, and you're going to work on lifting one sitting bone, kind of look like a spider. We could call this spider. And then lift the other. It should be fluid, and it should take as little muscular effort as possible. This is not some, strong arm type move. You're working on fluidity and ease of movement with no hip impingement, no groin pinch or pain, and in a way that does not cause these certain snarky psoas, what I like to call the snarky psoas, that does not cause these hip flexors to overwork. Okay, that's the whole point, is down training. Just because you've had surgery does not mean that the snarky psoas is going to stop misbehaving. In fact, it usually up-ramps its snarky behavior, at least for a time. And as you increase your level of activity, some of those same symptoms you had pre-surgically can come back again and rear their ugly head. Does not mean that you've retorn. It just means that motor patterning isn't there yet. So this is the first thing that we'll work on. Now to progress this, after it's nice and fluid and you can do this with very little muscular effort, it feels good and is pain-free, you're gonna bring the feet in. Yep. So now once you bring the feet in, it's gonna be more like a boat pose, okay? But I don't really like boat pose in yoga. It's kind of a show horse pose without a lot of functional benefit to it. So the way that I like to adapt it post hip scope is bring the feet together, and we're gonna leave the feet down first. This is much harder than the one we just did. You're gonna work on trying to lift carefully the sitting bone on one side and balance. If you fall over, that's all right. And then try on the other side. How does that feel?
A little harder.
It is, yeah, it's harder. It's a coordination too. You can feel how the motor patterning requires more concentration. Don't forget to breathe.
Hold my breath in for sure.
Yep.
And I find other areas compensating a little bit, trying to.
It does. It does. That's exactly what happens. You'll feel the muscles that shouldn't be working trying to substitute. And then that's your job, is to down train those, to get those to relax. And if you're not sure what should and shouldn't be working, again, that's where you go see a PT who really specializes in hips. Good. Now there's some progression from there, but I think this will get us started. Yeah, because you want to be able to just clearly bring, it's the pelvic floor, the hip muscles, the back muscles, and the abs should all in concert, like a cylinder, come on and work together so that you can easily and fluidly lift and you don't get those compensatory patterns. All right, I hope this has been helpful. See you next time.